Hi, I'm Scott Fletcher, a student physical therapist assistant at Fayetteville Technical Community College. I want to talk to you a little bit today about joint capsular restrictions, and particularly as it pertains to stroke patients. A stroke patient often will have some restrictions. They end up with a contracture, and especially in the wrist that we're talking about. And you'll see stroke patients holding their hand like this. This wrist in constant flexion ends up with a contracture there, and what we want to try to do is get some wrist extension back to increase their functionality. Now what's happening with this is over time, when the hand is held in this position, it kind of flattens out. I'll show you on this skeleton here. The hand has a natural curve to it, and normally with wrist extension, the hand comes up, the bones of the metacarpals slide towards the palmar side of the hand, and that opens that joint up and allows that movement in that joint. But when we have this joint capsular restriction, that slide, that glide does not take place, so we have a restriction here and are not able to get as much extension as we could if we had that glide. So what we can do is a joint mobilization to help free up that joint capsule. I'll show you here with my patient Sam. We've got him set up here on the table. You want to be able to support the forearm on the table, and the first step with this, we want to loosen up that joint capsule a little bit. So I'm using my fingers just at the base of the metacarpals and my thumbs here at the base of the metacarpals, but pushing in an opposite direction. So what we're doing is just opening this joint capsule up a little bit, just causing some distraction between those metacarpals and from the radial and ulnar bones here. So we do that for a few minutes just to loosen that joint capsule up a little bit. And then what we want to do is this joint mobilization, where we're going to distract a little bit first. So we around the hand and pull that joint apart. We're distracting that joint a little bit. We're allowing the table to provide a support on the bottom, and we're pushing downward. So we're pushing those metacarpals down towards the palmar side of the wrist. That's going to open that joint capsule up a little bit. So what we want to do is that distraction, a downward motion there to help free up that joint capsule. That will allow some space in that joint. It will allow the metacarpals to move and to glide to allow more wrist extension. It'll help with your stroke patients to get them out of this position and back to gain some more wrist extension.